You mentioned earlier that most of the fights in these comp claims now revolve around the necessity of a recommended form of treatment.
Right.
Can you tell us a little bit about some of the pushback you've gotten from CRPS clients who've wanted to go this nerve stimulator route?
Well, strangely enough, once they get to the point where doctors recommending a nerve stimulator, the workers' comp system has this utilization review we talked about earlier, and I've only seen one turned down at utilization review. So that's really, we fight like heck to get stuff. We fight to get the diagnostic tests and physical therapy and some of the other things. But once it gets to the point where they've seen a doctor that does that type of treatment and he makes a recommendation and it's reviewed by somebody in an outside agency, it's almost always approved. It's really weird because we'll fight over whether or not somebody needs a knee replacement or back surgery. And to me, this is a lot more significant, but that seems to be approved. There's several steps you have to get to that point, though. There's psychological evaluations. There's a test we were talking about earlier where they performed injections to deaden a nerve to see if that works. And then, the criteria with the physical therapy and the other things. So before you get there, there actually has to be a lot more treatment, which is usually where we end up getting the fights, especially with the injections. But once we go through all that treatment, to get to that stage, it seems to be more accepted by the medical community after you've done all the other things.